going on?
What's going on?
Good morning. Welcome to What's Going On. My name is Dolores Vidal, and with me is Janette Cranshaw, and we have the great pleasure of interviewing today Ken Farbstein.
Farbstein.
Would you please excuse me? I made a mistake. I will begin again. Mr. Ken Farbstein, who is founder and president of a company known as Patient Advocare. And as the name suggests, he is in the business of advocating for patients related to the care they might be getting in any healthcare system. And I mean any because he consults nationwide, although located here in the Boston area. He collaborates with a large network of skilled advocates, and he has served 2 elected terms as the president of the Consumer Health Quality Council of Healthcare for All, and is the author of a book which I think many of you might be interested in reading. It is called Getting Your Best Healthcare: Real-World Stories for Patient Empowerment, and it was published last April. He is a graduate of Stanford University with departmental honors, and also has a master's in public policy, which he obtained at Harvard's John F. Kennedy School of Government. So we are proud to have you here this morning.
Oh, thank you. It's nice to be here.
Thank you.
I got to know you because you were over at the Belmont Senior Center, and my husband and I heard you, and I ended up jumping in all the time with questions and comments.
Yeah.
And then I thought, oh, this would be fun to have a program on television. And again, it's this whole idea of how each of us, whenever we're a patient, sometimes we're nervous about speaking up and do I really need this test? I'm not feeling well and I've had 20 minutes for my medicine. Is it coming? And things like that. So maybe you'd like to tell us about some of the issues that come up that you need to be more gutsy to speak up, or a relative of yours to speak up.
It's hard sometimes because people are so nervous in that situation, and when you're in a hospital bed or a nursing home, you're really not your best self, and it's very hard to speak up for yourself in a situation like that. So it's good to have an outsider sometimes who can help you with that. It really depends on the situation so much, what kind of help to provide, and so forth. Sometimes it might be that someone's coming out of the hospital, they're about to be discharged, and yet they're not really sure that the discharge plan is going to be okay, is going to be good enough in helping them to get their life back right away. So in that case, a professional patient advocate might bring together the members of the care team, of the interdisciplinary care team in the hospital, and have a meeting, with the family member who is the advocate and the patient themselves, and kind of explain the game plan, especially if it's a complex case. But there are all different ways that advocates can be helpful.
Well, it just made me think of how, when I was taking care of my mother for the last 15 years of her life, she lasted till she was 95, that the big thing was the doctors would never get involved in saying, oh, it's not my job as to what happens when you leave here. You have to get a hold of a social worker and have her work it out. And I couldn't believe that, and I said, well, how does she know what is best? Somebody that we haven't seen before. And however, when just this past year at a different hospital, the person in charge of my operation knew exactly which rehab place I would go to, exactly what I would need, and I didn't have to open my mouth and say a thing. So I guess there are doctors who stand off and those who want to be sure a plan that's good for their patient. I don't know how the patient's supposed to know the difference if they...
Well, right, it's very hard to do that in that situation. It's a little bit too much to ask of the patient, maybe that they be the ones who are in charge. They're supposed to be the quarterback from the bedside while they have IVs. And it's an undoable, it's an impossible situation. But one thing to realize is that there's a care team who are caring for the patient, and so it's not that you have to get everything from the doctor, because there are nurses around, nurse practitioners, there are discharge planners and social workers, and so part of being an advocate is of knowing that there are other people who are there to, usually very compassionate people, very well organized and on the ball, people who can help if you think to ask them.
I think it's really very interesting at the various levels that you have become involved in this. I mean, you have worked with healthcare organizations, hospitals, where I think there tends to be a reticence to allow, quote, outsiders to come in and peer and peek and suggest and manage and help manage and create management. For example, in the management of medication errors, you have been involved in that as well.
Right.
And my thought is that you must have done a relatively good job, because it's your patient advocacy. You have been able to glean lots of information from the study, from the work that you engaged in or engage in.
So, for example,
and keeping up with the progress and what, for example, medical records as they are written today, and all the changes that take place. I mean, it's a wonderful thing to be able to be on both sides, I would think.
It's been a real education for me, and absolutely. So I had worked at the Harvard Community Health Plan some time ago, as I think, and you did, and they had a homemade, a homegrown electronic medical record system in those days, the AMRS, and then the second son of that, and now they have several generations later, and it's great to see now the world kind of catching up to them in terms of having electronic medical records that are now available. It's a very long time coming, and yet, and I find often that, I make jokes about it, and I write in my blog, Patient Safety blog, which has stories about people's encounters with the healthcare system, people's encounters, but I wrote one story about my dog's encounter with the veterinary system, because I was so impressed at how his care was better in some ways than the care that I had gotten, because at the end of every, and I don't remember if I showed this at the book talk that I gave in Belmont with you, Janette, earlier, but I sometimes bring around the summary of the visit that we routinely receive, we're handed on the way out. It's a paper, 3 or 4 page annotated, color-coded summary of what went on during the veterinarian's visit. And there's a picture of my dog, and there's our information, contact, his weight, his breed, and so forth. And then it goes bodily system by system, and there's a little paragraph on each one. And then anything where he needs special, one part that needs attention or something is in red. So it's quite striking. I'm thinking of one appointment, a well dog checkup, when we didn't realize that dogs also need to brush their teeth. And many of them can't handle that on their own, so it's important for the owner to help them with that. And so this recommendation in the visit summary actually said, well, you should brush his teeth, and here's why, and it's the same reason actually with the tartar and plaque buildup, exactly the same. And P.S. dogs prefer poultry-flavored toothpaste.
Oh.
So I thought that just grabbed me because it was so specific and so helpful that I never would have known in my own that poultry was the flavor when you got a bunch of other choices in the pet store. Apparently there are other choices, but you know, so to me this is what the electronic medical record can be and is not. You know, so that the record has the capability in it. Now you know, there's now federal legislation that requires over a period of a few years that doctors' practices to get electronic medical records.
Right.
But there still is not the requirement that the patient get something on paper at the end of it. And now these systems all have the capability of producing it. They can, but the question is, will they? You know, will you get that from your doctor? And so, you know, so it's, I often ask the audiences where I give book talks, well, have you gotten something this good from your doctor? Well, so I say, you know, my dog has better, you know, has a better medical record than I do.
It might be considered that HIPAA is a hindrance in that people, unlike dogs, are worried about privacy and who might have access as well as the patient to all that information. Is that, am I guessing correctly?
That's sometimes an impediment. That is sometimes a barrier. So HIPAA is, as not everybody in your audience may know, but it's the law about the privacy, protecting the privacy and the portability of healthcare information. So who can see my information, right? And that's, you know, that can be an issue. Now, a lot of times it's kind of a pretext for not doing, oh, we can't do that because of HIPAA. Well, they could really if you wanted to. I mean, but one thing that our listeners and viewers might want to know is that it's your medical record. It's yours. Right. And we don't think that way because it's in the doctor's office or it's in the hospital. They have a notebook and it's in there, but it really is yours. And we really should think about it that way. So, you know, you should have a copy of it.
Of course.
Right. And because sometimes there are little mistakes in there that, you know, or that you'll recognize.
I know when you were talking with us over at the senior center, what came up somehow was this whole thing of, like, if there's different doctors coming in to look, particularly in a training hospital where there's that they haven't, it's so obvious that they haven't read the record or it isn't up to date. And so everybody's got a different idea of how the patient's doing or whatever, and that must be very confusing for the patient. And I would say the main thing that concerned me is, and still does, we've got in our family, we've got 5 doctors, and that is penmanship. Most of them have never learned to use a computer. They don't know how to type, and so they write just handwritten notes, which are totally illegible. The same for prescriptions, and then they blame the druggist, you know, for a mistake where nobody could possibly read what they have put down. So the last time I was at my doctor's, I had 3 notes of things to do and prescriptions and stuff, and I could not read any of it. So I went to her secretary and I said, "This is unacceptable. I want you to type them all up, be sure they're accurate and legible, so that when I take them to, you know, a pharmacy, they can be." And she looked at me amazed, but she did it, and it was wonderful to be able to read something. So why are they so illiterate? I mean, that they cannot write, and even even in a signature, it's of course illegible. And the whole idea of being an educated country is that, I mean, I have things from our family Bible 150 years ago, and the beautiful handwriting in there is they would make an entry. And so the idea of going like that, so sometimes I send things back. I say, I don't know who this is. It's not like if it was typed underneath it, that's another thing.
Know.
But I said, I don't know whose this is. I would like to know who is the person who did this report.
So you're an empowered patient, and that's what, you know, we want people to be that. And so if you can't read, if you can't understand the doctor's prescription, then ask him or her to, you know, to spell that out. And that's, you know, to write it neatly, or to, you know, so that it's really clearly known.
So elementary.
In the work that I did with hospitals that you had mentioned, Dolores, I worked with 6 hospitals on one particular project over a period of 3 years or more to reduce medication errors, and the hospital system CEO CEO wanted them to become the safest place in the world for a patient to get medicine. So that was, that was the stretch.
Southwest Israel?
That was one of the, yes, and the care group hospitals, 6 at Mount Auburn and Waltham Hospital and several others in that care group system. And so, and because sometimes, we'll find, sometimes the doctors would abbreviate, in their haste, we put so much work on them that they have to work fast. They would write a capital U, which stands for the word units. Well, that's usually okay, but when it's not, and then so sometimes it gets misread as a 0. And then, so if there have been cases of insulin overdoses, where 10-fold overdoses, because that 0 at the end then can kill someone, or can or really create a tremendous injury. So we were trying to get, one of the things we were trying to do there was to get people to use not to use the abbreviations, but spell out UNITS for that reason. And so
exactly.
So we did different labeling in the pharmacies of some of the drug names that would sound alike or look alike. And so what you can do there is you could take the letters that are different in the drug name and make those in a much bigger font. So it makes it look a little funny, but you're not going to make a mistake of of confusing Hespan with heparin.
That reminds me, just this morning when I called a CVS to reorder something that I'd run out of, and I have asked them several times, and I asked again, the one thing that's never on the pill bottle, is what it's for. And I said, this is so dangerous. What is this for? The cholesterol? Is this for whatever? Or is this, if there's nothing on there, I don't know what medicine you put in here, if it's what I'm supposed to use it for. I mean, we've got a whole array when you come home from a hospital, and so forth. It's not just a matter of one little bottle of pills.
Right. So you really need to ask and be clear on what the reason is.
Yeah, I mean, there's plenty of in this bottle in tiny print, So I will see today when I go pick it up after this if they did do that. So I tried to save the old bottle and then write it in ink, and then get some Scotch tape and cover it so it does. If my fingers were wet, it doesn't blur. Why don't they just put on what it's for?
Well, that would
doesn't take a rocket scientist.
It would really It would really help a lot. And so these are the kind of ideas as an empowered patient that we want people to do these kinds of things. So there in the book there are a lot of very specific suggestions, but it's also about a mindset of what is it about to be an efficacious, an engaged, empowered patient, and it's kind of bigger than the sum of the individual little suggestions. But that's really the spirit of it, very much so.
What else do you advise people to be able to do? One thing we're covering quite a bit is this whole idea of speaking up if you have a question or confused. What else is a kind of an empowerment?
Right. Well, they say, in fact, the questions are the answer. So that's our solution. So please ask questions. And so part of that is to prepare your questions ahead of time. Before the visit. Before the visit. So a lot of these things need to be done really before the visit, because when you're in that moment and then it's, you forget things, or you're distracted, or they're doing a physical exam and it makes it hard to think, or
or he or she is in and out of the room doing about 10 patients at once, and you have until very recently only had 10 minutes for your annual checkup. And one day I did do it. I had 12 questions, but in a year I had accumulated 12 questions, so it could be answered very quickly. But, again, in case you're nervous, and you just go right down through the list, and it ended up a 45-minute appointment. And now, just in the last few months, they have switched to having 45-minute appointments for the annual physical,
So what you can do, if you have a calendar, a desk calendar, a Franklin planner, or something like that, a day planner, that on the day of the appointment, that you can, as you see the appointment coming up, you write down your questions on that page of your calendar, so that it'll be right in front of you when you have it there. And ideally, you can send it you can email it or fax it or mail it to the doctor's office a couple days in advance, so they know, and because they can appreciate if they. that they'll be able to answer what are the critical questions for you. So especially if you can prioritize them for them. So another thing in advance is about if you're in an emergency hospital situation. That came up. There was a story about my mother's care. And we're Jewish, and my daughter reached 13th birthday and had her bat mitzvah, which is a big family celebration. The whole family comes from around the country, and old friends of the family come, and her friends come, and so forth. And so my daughter did fine, and then the day after we had some brunches and things for people, and then people gradually left. And the next morning, my mother asked if I would bring her to the emergency room. And so, well, of course I will, tell me why. And so it turns out that she has some radiating pain in her neck. And so, of course, I immediately think, well, she might be having could she be having a stroke? And so, so we get ready to go. And it turns out that she's had this for a while, but that she didn't want to interrupt my daughter's special day because she didn't want to make herself the center of attention. So, when you have a selfless mom, this is what you do.
So
this is what they. It's so, and it's so dangerous.
Yes.
Yes, it's so dear and it's so dangerous.
Yes.
So,
the antithesis of speaking up.
Exactly. So I called a couple of the closest emergency rooms to see where there was less of a wait, and we wound up going to Beth Israel Deaconess, the Needham campus. We live in Needham, and on the way there, we called her primary care provider, physician in Atlanta, and had them fax the problem list and the medication list from my mother to the emergency room fax machine that's right in the triage area. So it can be done right away. So having that, and that may be something that your viewers may not realize, that your primary care physician keeps a problem, what's called a problem list of just a one-page summary of your key medical conditions, and should keep a medication list as well, which we all as patients should have as well. And so that information then could get faxed into and so there's a happy, there's spoiler alert, but there's a happy ending to the story. My mother turned out to be more of a, it was a calcification and impinging on a nerve, so it was a nerve issue that wasn't anywhere near as serious as a stroke. And she was able to we got her on the train to see her old friend in New York City, friend of 50 years or more, still on time, get her out. And there's more to the story, but the gist of it in this context was about the importance of getting that information to the doctor in advance.
I remember when being an advocate for my mother. My mother had me be the advocate for everything in the family. If it was something, repairs hadn't been done well to the plumbing pipes or anything like that, she always says, Janette, would you take care of this? Even when she was younger, because she was very shy, to speak up. And this way she preserved her ladylike image that I was the growler.
And you could be the pit bull. You're a little miscast though, Janette, no?
Oh, but I'm so passive, it was a lot to overcome.
There you go. There you go.
Well, one doctor, when I took her in, she was going to have a heart procedure done. And then he was going to probably discharge her the next day. And he wanted me to sign papers to say that no matter how it came out, that I would not sue them. And I said, are you kidding? You're going to have her overnight, and she's 90 years old with this procedure. You're not going to have her, in a recovery area long enough or being watched here. I don't know what to look for. I'm not a doctor. I said, of course I won't sign it. And if anything happens, if you do it this way, I will sue you for everything you've got. And he says, don't worry, don't sign.
So you're a tough customer, and then appropriately so. And it would, now.
And so they kept it for 3 days, and it was good because on the second day something happened, and boy, were they glad they had her there.
So your viewers may not realize that they can write in, when they're asked to sign something, that they can annotate it. Or they can, you cross out the parts that you disagree with and initial those parts so you tailor it, because this is, the way that Don Berwick says, Dr. Berwick says, well, that the caregivers in the hospital or in the medical world are guests in the patient's life. They are invited guests who are there for a time and who provide their tremendous service and then are not there, but that they are invited, but you are, it's really that you need to manage it in ways like you did, Janette.
How are we doing on time?
Ken.
Excuse me just a moment. How are we doing on time?
We have 5 minutes or less.
Okay.
Okay?
Yeah.
So
Good.
I'd like to thank you for coming today.
Oh, sure. You're very welcome.
I would like to just make sure that you all know about this book, because I think it would be quite educational for us to learn how to advocate for ourselves, getting your best health care, real-world stories for patient empowerment.
Where would we get that?
On Amazon?
It's on Amazon, and yes, and that's probably the easiest place for your viewers to get it. It's available both as an e-book and as a paperback.
And would you recommend people going on this patient safety blog? And how do people get in touch with you if they wish to do so?
Well, my contact information is there. They can go to patientsafetyblog.com.
Okay. Patientsafetyblog.com if anybody is interested.
And it has about 800 stories now of individual people's encounters with the healthcare system, and my dog Jackson's encounters as well.
Your dog Jackson.
Right.
That's great. Thank you so much for coming.
You're very welcome.
Oh, this has been wonderful. We could go on for about 2 more hours and barely scratch the surface. But that gives folks some ideas that the whole idea is to help everybody who's listening or knows somebody who is going through dilemmas to advocate for themselves, or to, get somebody in line to speak for them if they aren't going to be alert enough right after surgery to speak up or something like that.
And also to learn how to utilize the system to your advantage, so you don't have these crises occur and you feel as if you're more in control of the unknown, which is glaring at one in the face.
Exactly.
Thank you so much, and we've really enjoyed having you here. And maybe a year or so from now, invite you back if there are more cases, more situations.
Thank you, Ken Farbstein. Did I get it right this time? I
Absolutely.
hope.
Absolutely.
Thank you.
And so, till the next time, we wish you all a safe winter when snows begin to come now, I think, and to pass the word about our program. Thank you very much for tuning in.